Folks, thanks for coming on the line with us today. My name is John Dubois with Premier Marketing, and we'll be spending the next 45 minutes or so discussing a new opportunity that you have in the Medicare Supplement world, where we're going to achieve Medicare Supplement selling success with Humana Achieve. Today's presentation is being recorded, and that recording will be available on our website at premiersmi.com, on our YouTube site as well, and will be sent to all who have expressed an interest in today's presentation. A little bit of information about Premier Marketing to start. We're a national marketing organization founded in 1968. That's part of the Integrity Marketing Platform. We have offices across the country, and we act as an insurance wholesaler, providing insurance services through independent agents such as yourself. Those contracts are available at the highest possible commission levels, and we have recruiting contracts available for those who qualify. A bit of information about us. Well, this past year, we celebrated our 50th anniversary. That's quite an accomplishment for what began as a small family agency in rural Nebraska that's become one of the largest organizations of its type in the country in the Medicare space and ancillary product world. We do so through a full insurance portfolio, and those Medicare programs include Medicare Advantage, Medicare Supplement, and Part D prescription drug programs, and also a full portfolio of life insurance and annuity products, including final expense life insurance, pre-need plans, long and short-term care programs, disability income plans, and ancillary benefits that include dental, vision, and hearing programs, critical illness and cancer plans, and hospital indemnity programs. That Medicare Advantage portfolio includes all the national carriers and many of the strong regional carriers that can make a difference for you in your chosen market. That same philosophy carries over to the standalone prescription drug programs, and that full portfolio of national carriers are available to you through our organization. The Medicare Supplement portfolio is very robust and includes different marketing support programs that can help you be a success in this part of the Medicare world as well. The ancillary products, well, in each of those categories, you have the market leaders there available to you. And they are a variety of companies that offer different programs and different marketing support that behooves you to look into a number of the carriers to make certain that you have the programs that are in play in your market that can make you be successful in both a cross-selling notion and standalone sales as well. When we look at the Medicare market, it is a huge opportunity. And you don't come on a program like this without someone like myself telling you that, hey, the baby boomers are aging in, over 10,000 people a day, one every 10 seconds, however you want to divide it out in the numbers. But if you look at the numbers based just on someone's age, we're not quite accurately describing the market, because there are some folks who age into Medicare who choose to delay accessing those benefits for one reason or another. They're working past the age of 65 and access benefits through work. There's a number of reasons why they may delay in another circumstance. Their spouse might be working and they're accessing benefits that way. And it's also important to note that this misses about 1/6 to 1/7 of the Medicare market because they're under the age of 65 and accessing Medicare benefits because of disability. And so we have a Medicare population that is very diverse, a lot of challenges with their bodies because of a multitude of chronic conditions, and sometimes challenges when it comes to their wallet as well. So that makes a broad selection of products a necessity in our world to make certain that we can handle the folks that we visit with so we can best accommodate their needs. And pardon me, we have a little challenge there. When we look at the Medicare world too, people have different options when they come in to access the benefits. The first choice is doing nothing at all, self-insuring, completely for the medical and prescription drugs as well. Not too many people do that, but there are some that choose to do so. And then there are folks that also will pick up a standalone prescription drug program and self-insure for just a medical. And other folks will stay in the traditional Medicare system and pick up a Medigap policy, a Medicare supplement program, depending upon the benefit structure that they select at a premium that helps them with those expenses and that sort. Or they can go the Medicare Advantage route, which is also known as Part C, where they are assigning their Medicare benefits to a private company who then becomes their responsibility to deliver the benefit package that they have with Medicare. What we're seeing with different pieces of research that have been that's available in the market, Deaf Research tells us that it's about an even split when people come into Medicare as to which way they're going in the Medicare space when it comes to Medicare Advantage and Medicare supplements. Pretty even split, and then you got about 20% that choose to do nothing. And it is also an opportunity for us then to make certain that we have the products that the people need as part of our portfolio. In the Medicare supplement world, well, that's being offered a change for the first time in quite some time by the MACRA legislation that was passed in 2015 that comes into effect 1/1/20. MACRA is actually legislation that stands for Medicare Access and Chip Reauthorization Act, as I mentioned, legislation signed into law in 2015. And it's a law that requires anyone who is newly eligible for Medicare, effective the first of the year in 2020 and beyond, they may not enroll in a Medicare supplement plan that covers the Part B deductible, such as what's currently covered by Plan C, F, and High Deductible F. What that does for folks is create a different opportunity for those folks for coverage versus people that have been on Medicare in the past, because newly eligibles are those who have attained age on or after January 1st of 2020, or have first become eligible for Medicare because of disability, age, or end-stage renal disease at that time. It gives us a different way of looking at the packages that are available for folks. And this particular benefit chart gives us a realistic look at the plan types that are available for folks based on age and when they accessed into Medicare. Because it's important to remember that one size doesn't fit all. And a lot of times we see agents sell based on their own personal preference. And that can make them very passionate in that presentation, but it doesn't always accommodate the needs of the people they're addressing. In certain circumstances, it creates a circumstance where you do not get a sale because they're looking for something different than what you're offering. That's why we want to make certain we have different programs available. That takes us to our topic for today, and that is a newer offering by Humana in the Medicare supplement world called Humana Achieve. And it is a program that gives the buying public in the Medicare supplement space premium coverage that's affordably priced. So we'll go through a number of different topics today, including a bit of an overview on MedSups, kind of retracking some of what we've talked about, but some different perspective, a bit of difference garnered by the Humana Achieve program. We'll speak to the agent resources that are available through the offering of this product, including processes, extra services, and the value prop that comes with it, a little bit of a Humana outlook on 2020 MACRA, and then the contracting process. When you look at the breakdown that's given from Deaf Research the year prior than what we discussed, we see a little bit different split where more people were accessing the MedSup versus the Medicare Advantage. We saw in the previous piece that's 39 and 41, where 20% stayed with original Medicare. And you have some interesting statistics when it comes to demographics of a typical Medicare supplement buyer. They're generally between 65 and 74 years of age. Their average income is between $25,000 and $30,000. They're motivated by security, protection, choice, and control. An agent has a significant impact on the enrollment decisions that they make. 43% of that population, they live on their own. They're widowed, divorced, separated, or never married. but they do talk to their friends, they go online and study, and they do respond through direct mail. The top reasons why people choose Medicare supplements? Well, first and foremost, there are no network restrictions. They can access care with any provider of that care who accepts Medicare payments. They look for low out-of-pocket cost, and the programs are guaranteed renewable. As long as the person pays their premium, they're going to have that coverage. For us agents, this is a program that can be sold year-round. It's not just available through AEP. There's a lot of Medicare supplements that are sold during open enrollment, but that's because we have an impression with the buying public that it's a time to make a decision. This gives you an opportunity to sell year-round. In many circumstances, there may be guarantee issue periods with certain states more than others, but generally, as long as they can undergo medical underwriting, you got an opportunity for a sale. It has a very versatile portfolio where people can obtain coverages based on different choices of the benefits that are available, along with premiums at different amounts. And when you look at client retention, the average policy stays on the book between 7 and 8 years. It has strong commission and bonus structures with the different programs and carriers out there. So let's look at a Humana Sup versus a zero premium program. And let's use the example of John, who lives in Alabama. He's a non-smoker and he's looking for his first Medicare plan. Last year, his circumstances in his life, well, he visited his primary care doctor 6 times. He visited a specialist once a month. He went to the emergency room and he had an MRI in the hospital. And he spent 7 consecutive days in that hospital. Here's what John would have paid on a Humana supplement, Medicare Supplement Plan G versus that zero premium plan. A big difference up front is the premium, or he would have $120.80 premium in Alabama versus that other program that's available without a premium. In this circumstance, both of those programs had a $185 deductible they had to satisfy, and the primary care doctors were covered at no cost in both programs. A specialist, however, costs $35 per visit with the zero premium program, where the Plan G covered it completely. The emergency room visit was covered completely with the Med Sup. It was $90 copayment with the zero premium plan. The MRI in the hospital, 0 versus $260 because it was a day. And then the hospitalization, well, it covered it completely with the Med Sup. It was $260 a day for those 7 days each day. And you see then a total cost of that coverage and the services provided with the Med Sup at $1,635.44 to be precise, where the zero premium plan was $2,775. So you see a difference with the maximum out of pocket. What you have with a max out of pocket with the Med Sup is the premium and the expenses that were incurred, which is basically the premium and that Part B deductible, and then the max out of pocket, the MOOP, on the zero premium program in this particular circumstance was $5,700. That will vary along with these other benefits depending upon the location that the person lives in, where the Med Sup coverage is constant across the country. So you have some different things that can come into play. The Medicare at zero premium program, those benefits can change year over year as well. We do see also some of the other things change based on the base Medicare program benefits, where the Part B deductible is subject to change each year. It hasn't been too terribly pronounced over the last few years, a little bit bigger bump going into 2020. So why would you look at Humana Achieve Medicare Supplement plans? Well, others agree with us when it comes to Humana's brand strength. Forbes rated it the #1 healthcare provider in the country. Newsweek rated it the #1 carrier in customer service among health insurance carriers. It was the 3rd best health insurance company according to healthcare.com, and #5 most valuable healthcare brand in 2019 according to Brand Finance. And it's one of the largest health insurance insurers in the South. When you look then too of some of the specifics for why this program, they have a wide variety of Medicare supplements, and it's the most competitive Humana Medicare supplement to date. And it maintains a very competitive Plan F for switchers. Because remember, Plan F isn't going away. The people who have a Plan F may continue to shop other Plan Fs as well. And if the premium is conducive for a change or for another reason, well, they're going to probably switch. Street commission with these programs are also up from what they have been in the past with Humana, up 2% in most states. And the plan and commission has increased as well. You also see an increased household discount, which is up to 12% in most states, and it offers a lucrative agent marketing allowance too. What you're seeing with these programs that you're seeing with certain med sup carriers across the country, that while the base benefits are standardized and modernized, many carriers are adding, or certain carriers I should say, are adding some value-based, value-added services. Humana does with their Achieve program, and includes well-dying, hearing and vision discounts, and other programs that can make this a bit different than some of the others that are out there. Certain areas do offer the Silver Sneakers program as well. When you look at the footprint currently, it's filed or live in 25 states. And you can see those areas as they roll through on the screen here. So for folks that live in these very populated states where you have an immediate offering, you have a very valuable option for your Medicare supplement clientele. The marketing allowance, well, you can earn up to an additional $80 for every issued case in a month. You've got to sell a minimum of 3 underwritten cases in a month to get it, but it is for a payout on the 20th of the next month, and there's no limit to those earnings. As long as you keep writing, you keep earning extra. This is the program for the final quarter of the year, so through December that still comes into play. There are certain states that don't participate with this because of legislation in those states, and it may exclude guarantee issue business in certain other states as well. We'll look for new programs going into 2020 as well. When we look at the agent resources that are available for the program, Humana offers a great fast app option, their online enrollment tool, which gives you different signature options. You have an e-signature that's available, a digital signature captured through a signature pad, and voice signature, which is very necessary for call centers as well. You have an abbreviated average issue time as well. In open enrollment and GI, it's 2 to 3 days on average. Underwritten cases generally take 5 to 7 days. The program that enables you to do this online tool, well, there's training available specifically for that on the Humana Advantage agent site. When you see some different numbers that come into play, well, the MedSup pending status indicators, these are the average time frames that are based off of electronic submission, non-peak times. So keep in mind, a paper application takes a bit longer, but when an application is received, within a day or two, you get acknowledgement that that application is in-house and is beginning to be worked. For electronic submissions, hey, that happens within an hour, or pardon me, within a day of that app being processed, where the paper app takes 2 to 3 days. Validation in process is what happens in days 2 to 4. This is where any information that is missing is being obtained and internal pins are being cleared. And it will remain in that status until the Humana receives the information necessary from the writing agent. The underwriting and process period, that's a 3 to 5 day period. Outreach by underwriting for the member will occur within 48 hours of the underwriting receipt, and the agent, you'll receive communication after there have been failed attempts to reach the member. So they're going to try and take care of that themselves without having to involve you in the process. That processing is days 5 through 7. And once the application's been cleared of all the pens, missing information, and the underwriting request should be issued within 24 hours. The policy issue date for the guarantee issue and open enrollment period averages 2 to 3 days, as we stated before. Underwritten average 5 to 7 days, and then the policy number is issued to the member. The resources you have available, you have all the wonderful contact information to stay in touch with Humana by both phone and email as well. One of the things that I always recommend to an agent, even if they are calling, is they follow up by email to make certain that they can track and prove some of the circumstances that come into play. You also have a very handy underwriting reference guide that's made available for Humana, so you have a better understanding as to some of the requirements that come into play for the product. When it comes to marketing the program, you got a nice buck slip that you can use in different types of advertising that's customizable for you with your contact information and your picture. And you have a flyer available as well that gives some of that same information available for personalization with you, who you are, how to get a hold of you, hey, what you look like. They're attractive pieces that garner a good return. If you are recruiting agents as well, you have a nice piece that comes into play that's all approved, much as the other pieces that we have mentioned already, where you can just plug and play, and these are very accessible with mobile devices. Studies have shown that the majority of folks are accessing their information on either their phone or an iPad, and these pieces come across very readable in those formats. You also have different pieces that are available for training the agents and your staff. These different PowerPoints and the other pieces of information are available to you and are available once contracted. So kind of a rehash on some of the pieces that come into play with it. Why you want to consider this? Well, you have the elimination of that Plan F, the high deductible Plan F, and Plan C for the individuals newly eligible after 2019. That's that MACRA legislation. Plan G is the closest substitute for Plan F. The only difference is that Part B deductible, which this year is $185. Plan G is really growing in popularity and will continue to grow. And Humana also has introduced a high deductible Plan G rates, Plan G with rates that are available for 1/1/20 effective dates. And they'll continue to allow this enrollment for individuals who have been previously eligible as well, so they have additional choices available to them. So let's look at some different questions that come into play. MACRA, once again, tells us that F, high deductible F and C are not going away, but they're only eligible, the only individuals who are eligible for that coverage are folks that were on Medicare before the first of the year. And if you have someone who is under 65, currently disabled on a Medicare supplement now, they too can pick up that coverage because it's based on having Medicare coverage, not necessarily just being over the age of 65, where you'll see in many states where these people, if they pick up a Medicare supplement plan, sometimes their only option's been a Plan A. Well, when they turn 65, that changes for them. When you look at this question too, is Humana looking at large rate increases on those plans after 1/1/20? Humana feels that because that is a large part of the block of their business now, you should be able to process and assess that rate renewal process, much as what they've done in the past. Might be even actually a little easier since there won't be guarantee issued going into those programs. And their typical med supp increases have been annual and tend to be between 3 and 6%. When you look at the current membership mix that Humana has with their Medicare supplements, you'll see that the vast majority of it's been in the Plan F, much as it has been across the industry. When you look at where it's going since the first of 2019, you see a lot of that business now being put into a Plan G in response to the MACRA legislation, which takes effect 1/1/20, and some of the aggressive pricing that has been part of Plan G offerings across the industry. What you have overall with Humana and Humana Achieve products is a increased collaboration between the internal resources of Humana and us as sales partners in order to help bring the best product to market. It also gives us a focus on price competitiveness, simplification, and product fit. It gives us the opportunity to sell competitive Plan F premium to Plan F policyholders looking to switch. That's going to remain a huge piece of the market. And the collaboration between the Humana team and leadership across the industry is really giving a unique way of perfecting the approach to increase overall MedSup sales as well. There are continuing opportunities for training, recognition, and championing the product brought to you by Humana, and I will add this, their partners in the world such as ourselves. So in order to contract with the program, you're sent an electronic link via the Ultimate Upline from Humana Producer Onboarding, and it requires an NPN and Social Security number or tax ID number. It requires the state license information for the areas that you choose to market. You can obviously market in more than one state, and it wants to make certain that they can pay you, so they need your bank account information for direct deposit. That contracting link is active for 30 days, and if a person doesn't complete it, they're going to get immediately. They're going to get a reminder 5 days prior to the expiration of that link. If you have any questions, we'll be happy to deal with them on a one-on-one basis to make certain that we deliver the answers you need in order to make certain that this product can become a valuable part of your overall offering. Some of the things you get additionally from us here at Premier, well, we help make the electronic contracting process easier across the board. With Humana and this product, you have a direct link from the carrier, but you also have the opportunity to create within this system an agent profile. And that way you can have the information you need to electronically contract with a multitude of carriers and do so with a minimum of effort, because it's going to autofill the contracting for the carriers that participate in this program and make it very easy for you to do so. We also offer discounted E&O to qualified agents, where you have a discounted policy to protect yourself for errors and admissions. And this is a necessity for us in the independent insurance world, because there are very few agents out there that put all of their product with a single marketing organization. This policy will cover you regardless of whom you contract different insurance programs through. We also offer you the opportunity to make certain that your license stays into play with bundled CE courses, continuing education through our association with WebCE. And as an independent agent, you create your own benefit package, and this gives you the opportunity to access a individual non-cancelable DI program for yourself, and it is available with modified guarantee issue at discounted rates, and you share in the commission on top of it. We do a multitude of different training programs, and as we go through these different offerings, much as what we're doing today, we record them, and they are available to you in a listing and on our website at premiersmi.com. So you can access these recordings 24/7 at your leisure. Much as what we do today, and we address specific products, we also address and make available different marketing techniques and programs out there to make certain that you have folks that you can visit with the programs that you offer. We do also offer different pieces of electronic support. Our quoting tools through our contract with CSG gives you the opportunity to look into your target market, see what programs are most competitive there, and access additional cross-selling benefits. It gives you an opportunity to look at Medicare Supplement plans, different ancillary programs that you can cross-sell with, and it's also now a repository for scopes of appointment, where it'll store them and a way for you to reach out electronically and obtain those scopes, and also make certain that you have an opportunity for many carriers to do an electronic application straight through the quoting tool. We also offer an electronic system for you for the Medicare Advantage and prescription drug world as well, where this program will actually maintain your information, act as a CRM for you, where you can do year-over-year comparisons, not only for the folks that you have enrolled, but also those people that have chosen to go another route, but you still have permission to contact them. It's also another great way for you to collect a scope of appointment and store it for that 10-year period as required by regulation. And it also gives you the opportunity to send out a link that will enroll people electronically. It also creates a microsite for you to drive your business as well. We do have a program also to help you put your social media marketing efforts on autopilot through our Coverage Made Easy program. And we take all of the incentive programs, put them in a singular area so you have a way of maintaining contact with all those extras that are available to you through different carriers, the different incentive programs, the trips that are available. And keep in mind, all of that production also helps you qualify for Premier's Producer Convention as well, which this coming year in 2020 is a cruise from Miami to the Bahamas. So if you're one of those sun worshipers, this is a trip to aspire to. We do also help you with different lead programs. We have contact lists available for you based on different markets that you give us some of the parameters so we can pull a correct list for you. That's available to you either at a very nominal fee or no cost, depending upon your contracting circumstance with our organization. We also make certain that you're plugged into the different community-based marketing programs. Those include the retail marketing programs with Walmart and those offered by different carriers. And keep in mind that those programs in many circumstances will extend beyond AEP. Walmart is marketing those a bit differently this year than what we've seen in the past, and they are looking for agent presence in those stores throughout the year. Obviously, you wouldn't spend as much time marketing there, but it gives you a base right there in the community. We also have systems designed for you to help access those centers of influence, which include faith-based organizations, an approach for that, and pre-approved presentations for seminar selling, and an additional program to help you market through the providers that deliver the care for the programs that you're selling. Carriers do offer different prospects during certain times of the year, and we want to make certain that you get your fair share for those from the companies with whom you contract and produce. We have internet lead programs as well, a Facebook program for leads for both our final expense and now in our Medicare world as well. And we offer direct mail support based on production that will deeply discount the cost of a mailing for you with a tried and true service through our preferred lead vendors. Hey, it still works. So what we're looking to do is work with you. We want your business and we're asking for it. If the programs that we offer, including our featured program today with the Humana Achieve Medicare Supplement program, if that is a strong part of a future marketing program, well, that's your decision. If you look to integrate that into your personal marketing plan, we need to get you contracted and up and going. You can reach any of us here at Premier through our toll-free number at 1-800-365-8208 or through our website at premiersmi.com. We look forward to visiting with you in the very near future. And in the meantime, we wish you good selling. Thanks so much, and we'll talk with you soon.